mental psychiatric disorder have more probability of acquiring hospital infection.
I will share my screen. Wait a minute. Can you see my screen?
Yes.
Yes, okay. Can you hear me?
Yes.
Okay.
Thank you.
Hello to everyone. My name is Huang Wei Ling. I'm a medical doctor from Brazil. The study I will present at this moment is entitled "Why do patients with mental psychiatric disorders have more probability of acquiring hospital infection?" This theme we are following by Hippocrates' thoughts that said it's more important to consider other ancient medical traditions prior to the knowledge we have nowadays. And we will discuss this theme by the energy point of view according to traditional Chinese medicine. At first, it's important to state how I'm talking specifically general hospital in this study, not considering psychiatry hospital in this case, as they usually do not recommend the use of antibiotics and do not perform invasive procedures such as surgeries. And when I started to perform this study, I created the main idea of this presentation using the knowledge of TCM and the ancient medical tools. And regarding Western medicine, I started a research of the literature as soon as I started my way of reasoning. In this research, I observed that there are possible links created between infectious disease and mental psychiatric disorders. For example, in this study entitled "The Links Between Infection and Psychiatric Disease," written by Benedetto Vitiello in 1997, it is stated that infection by a group A beta hemolytic streptococcus has been etiologically linked to a specific neuropsychiatric symptomatology, probably through the production of an autoantibody to react against neurons. Another study from last year demonstrated that a large Danish population-based study provided strong evidence of an association between childhood infection, antibiotic treatment, and subsequent neuropsychiatric disorders. Another study performed in Brazil showed that many times mental illness are also hard to diagnose. In this study, it is stated that although 30 to 50% of general hospital patients may present a psychiatric disorder, only 1 to 12% of them are referred to assessment. For Western medicine, the mental psychiatric disorders are seen in a spectrum of different neurological and psychological disturbances that may reflect in the patient's daily life and functioning. These disorders for Western medicine do not seem to have any relation with the functioning of the rest of the body, and having a mental psychiatric disorder such as depression or anxiety is not considered a risk factor when undergoing surgeries. However, also in Western medicine, the treatment is mainly performed with the use of very strong medications called in the Arnschutz law as high concentrated medications. And these drugs can drop the vital energy of this patient according to this law that I show you in my last presentation. Therefore, the law considering the concepts of energy, and according to this law, Arnschutz law, these patients would be weaker in energy and more propense to acquire other chronic or systemic disease. I've been presenting worldwide several studies demonstrating the association of energy imbalances and alterations leading to several disorders, such as myocardial infarction, nosocomial and community infection, diabetes, hypertension, severe allergies, and even cancer. And observing the teachings of traditional Chinese medicine, I could notice how this perspective of medicine consider the mental disorders as energy imbalances in different meridians of the body. In the study of Stephen Aoun from Canada entitled Traditional Chinese Medicine as a Base of Treating Psychiatric Disorders, a review of theory with illustrative case, the author states that mental illness is remarkable significantly. And the author states that in TCM, psychiatric disorders frequently related to energy disharmonies involving the so-called five spirits. On these studies of mine, I observed the energy imbalances of many patients that come to my clinic with mental psychiatric disorders, and what they had in common was the presence of heat retention leading to these psychiatric disorders. I was able to perceive that the patient with depression and anxiety had the same root or energy imbalances that are the deficiency in energy, but the difference between depression and anxiety is that the anxiety patient had the development of the formation of the heat retention, and the depression patient doesn't have this heat retention. And they have in the root the same root that are the energy deficiencies between yin and yang blood that I show you in my last presentation. A patient with panic attack syndrome present heat retention in the gallbladder meridian and are deficient in kidney meridian. And the deficiency of energy of these meridians can lead to formation of internal heat that can present an inflammatory process and can induce the formation of the infectious symptoms when hospitalized. And in patients with schizophrenia, they have the energy imbalances leading to schizophrenia in the TCM is the heart, retention of heat in the heart meridian. And when we treat this heart meridian, taking off this heat retention, the schizophrenia patient would improve their symptoms. In my first study entitled Acupuncture Can Treat All Disease Simultaneously, presented in the Harvard in 2015, I studied the functioning of these energy balances of yin and yang blood energies and observed how the deficiencies of any of these four energies would imbalance the whole system, as well as creating the heat formation and retention in the body that could lead to a range of physical and mental symptoms. And to understand better why this theory makes sense, it's important to briefly explain the metaphor of the tree that I've shown you in my first presentation, emphasizing that the mental disorders are only the leaves in the branch of psychiatry specialty. And as you can see in this slide, the metaphor of the tree places a link between traditional Chinese medicine that treats the whole tree, mainly in the root and considering the external pathogenic factor, while the Western medicine treats the leaf of this tree. As you can see, using Western medicine reasoning, the symptoms of various mental psychiatric disorders appear in many leaves of the branch of the psychiatric specialty. And the nosocomial infection, on the other hand, appear on the other non-related leaf of the tree, connected to the branch of infectious disease. But what they have in common is the root of the tree that can have the energy imbalances leading to symptoms in the mental disorders and leading to the symptoms in the infectious disease branch, and having the same root of the problem that is the root of this tree. And the main purpose of the treatment here is to turn this tree upside down, as you can see in this slide, treating the root first and not the leaf. Even though when looking at the tree, the branches of psychiatry and infectious disease do not seem to connect or to have nothing in common, But when turning the tree upside down, it's possible to perceive that the problem is in the root on the energy imbalances and that the root connects the two branches. And as it's common for the patient with mental psychiatric disorders to have heat retention as the main cause of the disorder, I performed the procedure of apex ear bloodletting, as I showed in my first presentation, to take out the heat retention. In that presentation, I was using this procedure to take out the heat to treat the infectious process. And in this presentation, I usually use the apex ear bloodletting to take out the heat to treat the majority of mental disorders. But when I use in the depressive patients, they don't have so many improvement with this, because in depression patients, they don't have the heat retention compared with the anxiety patient that can improve very fast their anxiety symptoms using this kind of treatment, taking out the heat retention. And the majority of patients with mental disorders I observe in my daily practice have a chronic energy deficiency leading to their clinical presentations. And patients with psychiatric disorders and therefore with chronic energy imbalances will have more tendencies to form heat retention, and usually the excess of use of the medication inside the hospital associated with the several invasive procedure, the inadequate diet, the exposure to external pathogenic factors are some factors that contribute to the increased deformation of heat retention. That is the energy imbalances that will show itself as the symptoms of infectious process. Not necessarily caused by the infection, but only the energy imbalances itself. And consequently, when a patient in this condition needs to undergo a surgical procedure or is admitted to the hospital environment for any other reason, this patient will already have a tendency to react worse to the hospital environment, because the energy of this patient is already weak and he has the internal heat before the hospital admittance, and will worsen the formation of internal heat with the treatment in the hospital. But nowadays, the hospital environment, as said as previous presentation of mine, has a very cold weather, and with the use of air conditioners, as the energy of this patient is already weak, the body will have no defense against the cold and wind entrance. And these two factors are considered in TCM as the external pathogenic factors that can alter the energy of the body and increase the formation of internal heat. And when this wind and cold penetrates the body, it may cause fever, respiratory tract infection, tonsillitis, or even pneumonia, among other symptoms. And Western medicine then will be treating these symptoms with antibiotics that are high concentrated medications. And there will be marked drop in the vital energy of these patients, causing a cascade effect of complications, inducing more formation of internal heat and consequently forming more symptoms of hospital infections. And I show you the study that I published 2 years ago. And the second study is that, is it possible to treat acquired nosocomial infection with the same method and without the use of antibiotics? In this study, I'm showing that it's possible to treat both kinds of infection without using antibiotics, only consider the energy point of view, balancing the internal energy and taking out the heat retention, and changing the dietary aspects in the energy point of view according to energy imbalances of each patient, and considering the external pathogenic factors and orientating the patients how to prevent their entrance in the body to don't cause the energy imbalances. And in this two study, I state that what I have been observing in my daily treatment of patients, internal heat retention plays a lead role in the development and worsening of hospital infection and the use of high concentrated medications such as antibiotics, antidepressant, anxiolytic, sleep inducer, anticonvulsants, etc. in patients with energy deficiencies can lead to a reverse effect, worsening the symptoms instead of improving them. Thus, a patient with psychiatry disorders will already have arrived at the hospital with an energy imbalances having an increased tendency to form internal heat retention, which is responsible for several symptoms that may be mistaken for hospital infection, such as hyperemia, yellow secretion, etc. And as stated in my presentation, it's very important to associate the reasoning at the energy imbalances to understand better why these patients have more tendency to develop a hospital infection, even though the majority of Western medicine studies do not present this relation. It is important to associate both types of medicine, Western and traditional Chinese medicine, and consider the internal energies of the patient when developing diagnosis and treatment. And traditional Chinese medicine invites the physician to search for the answer at the root of the problem, that are the root of this tree, when at the source of the energy imbalances itself. And the conclusion of this study is that studying the energy imbalances of the patient with mental psychiatric disorders, it is possible to understand why this patient would have more tendency to develop hospital infection when these patients are admitted to the hospital environment to be submitted to surgery or for other general treatments. According to Hippocrates, everything in excess is opposite to nature. Thank you for your attention. If you have any question, I will be happy to answer you. Thank you.
Thank you for your lecture. Any questions? Any questions for Dr. Huang Wei Ling?
Yes, I have. Sorry.
Oh, okay.
I was just imagining, you know, those patients, psychiatric patients who arrive in the area and it's agitated or something like that. What is your first initial thing? You know, aggressive, agitated, confused, you know, that kind of patient. What is your initial approach?
Yes, this kind of patient that is agitated and irritability and aggressive, these all mean signs and symptoms of heat retention. And in my daily practice, I usually do, I bleed the apex ear of the patient and do the auricular acupuncture to reestablish the energy of the patient, and he will be calm. And you will need to take out all the medications that is inducing more formation of this heat retention. That is all high concentrated medication that he is intaking, that is several antidepressant, anxiolytic, and for insomnia, and for all kinds of medication that he is intaking in the hospital, for antibiotics, anti-inflammatory medication. All these medications are inducing the energy imbalances, leading to this kind of result in the symptoms in the patient. But that's because the use of very strong medications and leading to these energy imbalances and forming the heat retention. And that is why the first approach I usually do is do the apex ear bloodletting. You can take out about 5 to 10 drops of blood in each of the ear. And if you can reduce some medications to don't to induce the the decrease in the vital energy leading to more formation of internal heat, this is a good approach. But normally they don't do this. They give more medication. And that is why the patient will recover from the symptom, but in the energy point of view, he will worse the energy imbalances that is leading to that symptoms. Okay?
Okay, thank you.
You're welcome.
No, because here in the Western side, usually what they do is an injection immediately of anxiolytic, sedative or something like that. Yeah.
That is all the symptomatic treatment. You are treating in the leaf level of the tree, but if you treat the root level is different. It's the approach is different. That is why it's important to take if you can reduce you cannot reduce take out from one day to other all the medication, but if you can reduce this kind of medication slowly, the patient will have more better quality of life in the future. Because the psychiatry patients nowadays, they usually use many medication, 15 to 30 piles for each day, and they don't have a good quality of life nowadays. And if you can reduce this kind of medication and can treat balancing the internal energy, this will give them a better quality of life, and their life will be more, they will feel the life better, because nowadays they don't have life. They are controlled only by the medications. They don't have life, this kind of patients. They don't have life, they don't have memory, they don't have concentration, they don't have sexual function, they don't have anything nowadays. They only are surviving by the medication. They don't have, and that's, we need to balance and give to balance the internal energy that is leading to that disease, that schizophrenia or anxiety or panic syndrome. Only if you treat this kind of energy imbalance, you can recover the patient very well without using many kinds of medications that is worsening their energy balance.
I think, I think we just give more information for this Western medicine, or, information to them, because probably they don't know, about, what I learned now about the roots. Okay, actually, they don't know like that. So
because
we have to educate them. We have to educate them.
I know, because
so probably you have to come to Canada to educate.
Okay, if you invite me, I can go. And the treatment is very simple, and to balance these energies is not very difficult to learn, and it's very simple, and all the patients will have a very good quality of life. If you can reduce their medication, they will be very happy and started to feel how the life is, the real life, because nowadays they don't live the
does it goes to does it go does it goes also for those patient post-op agitation? Because sometimes there are some people who are, after operation they have confusion, agitation. Hello? Now we're